What are the ethical dilemmas in genetic diagnostic testing? What are the ethical dilemmas in genetic diagnostic testing? This is a question that many people ponder as they consider the implications of genetic testing for themselves and their families. Genetic diagnostic testing involves analyzing an individual's DNA to identify potential genetic disorders or mutations that may lead to disease. While this testing can provide important information for diagnosis and treatment, it also raises several ethical concerns that deserve attention. One significant issue is informed consent and autonomy. Individuals must fully understand the nature, benefits, limitations, and possible outcomes of genetic testing before agreeing to it. This means providing clear and unbiased information so that patients can make informed decisions. They need to know what the test can reveal, the psychological impacts it may have, and how it could affect their family members. Privacy and confidentiality are also major concerns. Genetic test results are sensitive and personal. It is essential to keep this information confidential to prevent unauthorized access. There is an ethical obligation to protect individuals from potential misuse of their genetic data by employers, insurers, or even family members. Patients should be informed about who will have access to their results and under what circumstances. Another ethical dilemma involves the potential for discrimination and stigmatization. Genetic information can lead to unfair treatment in employment, insurance, and social situations. Individuals who carry certain genetic mutations may face stigma, raising concerns about fairness and justice. Protecting individuals from such discrimination remains a challenge in the field of genetic testing. The psychological impact of receiving genetic test results is also significant. It can lead to anxiety, distress, or changes in self-image. Additionally, because genetic information is shared within families, results can affect family dynamics, potentially causing discord or guilt. Ethical practice requires providing adequate counseling and support to help individuals and families cope with these outcomes. Testing minors and newborns introduces further ethical dilemmas. Testing children for adult-onset conditions, where no immediate medical benefit exists, raises questions about protecting the child's future autonomy. It is often suggested that such testing should be deferred until the individual can make their own decisions, unless early intervention can improve health outcomes. Equity of access to genetic diagnostic testing is another ethical concern. Ensuring fair access across different populations is vital. Disparities in availability or affordability can lead to unequal health outcomes. Healthcare providers have a responsibility to offer testing to all at-risk individuals without discrimination. Finally, the use and interpretation of results requiring careful consideration. Healthcare professionals must be skilled in ordering, interpreting, and communicating genetic test results. Misinterpretation can lead to inappropriate medical decisions or unnecessary anxiety. Ethical practice involves proper training and referral to genetic specialists when needed. The rise of direct-to-consumer genetic testing also raises ethical questions. These tests may lack adequate pre- and post-test counseling, and the accuracy of results can be uncertain. Misunderstanding results without professional guidance can lead to confusion and distress. In the context of family genetic testing and hereditary health, these ethical issues are particularly relevant. Genetic information often affects not just the individual but their relatives as well. Providing clear information, ensuring confidentiality, supporting informed decision-making, and addressing the psychosocial impact are essential to ethically managing genetic diagnostic testing within families.